Danas ng pait ng pandemya, mula sa mga nahiwalay sa kanilang pamilya hanggang sa mga pumanaw na. Panginoon, layon namin ng mas magandang kalidad ng buhay, lalong-lalo na para sa mga kababaihan, sanggol at kabataan. Nawa ay matulungan namin ang isa't isa.
Good morning. My name is Aya Escobar from the Family Health Division of the Disease Prevention and Control Bureau of the Department of Health. We are glad to have you with us in celebration of August as the National Breastfeeding Awareness Month. For those who are not able to register for the Zoom session, we will be recording this session and we will be uploading the recorded session to the Healthy Filipinas DOH website, Facebook page, I'm sorry. Thank you to our Centers for Health Development, the regional offices of the National Nutrition Council, the National Nutrition Council Secretariat, and partners who have joined us today. This session is made possible by the support of the World Health Organization, United Nations Children's Fund, the Korean Embassy, the Korea International Cooperation Agency, and most especially the National Nutrition Council. Our session for this morning is for local governments and health facilities.
Good morning, everyone. I am Jelian Palencia, the Nutrition and Breastfeeding Outcome Manager of the Center for Health Development, Calabarzon, and we are happy that you are with us today. Same with the other Centers for Health Development, Calabarzon, is one with the celebration of the National Breastfeeding Awareness Month. And thank you to all our local government units from all over the regions in our country who are with us today.
So before we start on the meat of today's discussion, we are welcomed by Dr. Rosa Minerva Obinluan. We all know her as Doc Mimi. Doc Mimi is the lead official of the Technical Assistance and Resource Management Team of the Family Health Division of the Disease Prevention and Control Bureau at the Department of Health. Good morning, Doc Mimi.
Hello, everyone. Am I clear and loud?
Yes, you are, ma'am.
Okay. For a start, good morning, and thank you for joining us in today's session. We are reminded during this National Breastfeeding Awareness Month that breastfeeding is a learned collaborative effort. It takes a massive amount of support for our women to encourage and uplift them during breastfeeding, from her family to her community and the spaces where she exists. Welcome to the first technical session for this month's celebration, titled The Who's, Whys, and How's of Establishing Human Milk Banks. Human milk banking is one of the core interventions in our system for managing small and low birth weight babies and those who have been separated from their mothers, and storage of human breast milk for emergencies and disasters. We have seen this through the multiple unfortunate events we have gone through as a country. There is a misconception that human milk banks exist as breast milk reserves for those unable to breastfeed, and this is not the case. The Department of Health and our partners in the implementation of the first 1,000 days strategy emphasize that the first food system for newborns and infants should always have optimal breastfeeding at the center because its complete immunologic, nourishing, and psychosocial effects on our children. Breastfeeding begins with education, management, and support. To date, we have more than 20 human milk banks in the country. We enjoin everyone today to participate in a collaborative strategy to ensure access to human milk banks in strategic locations in the country. So no small or low birth weight babies or motherless babies are left behind. More importantly, we are taking this opportunity to also emphasize that mothers have to be protected from possible exploitation and prevent them from causing harm, given the rise of unregulated sharing, sale, and distribution of breast milk prevalent in e-commerce platforms nowadays. Breast milk is a product of human origin, and its ethical and safe use is currently being developed in a national policy, including standards for human milk banking. This is something that the Department of Health aims to deliver before the end of the year. As we begin today's session, we thank the Human Milk Bank Association of the Philippines and Alive and Strive Southeast Asia for indulging the Disease Prevention and Control Bureau in further educating ourselves and our colleagues in health facilities and local government units on the use of breast milk and human milk banking. We thank UNICEF, the Korean Embassy, and the Korea International Cooperation Agency for supporting this activity. Further, we extend our gratitude to our Centers for Health Development and the National Nutrition Council Secretariat and regional offices in extending the invitation to the REACH networks, ensuring that this information further reaches our local partners to whom this discussion are intended. May we gain answers to the questions we have always had on human milk banking and helping support optimal infant and young child feeding practice. Thank you.
Thank you very much, Dr. Vinluan. Hello, Aya. Good morning. Again, I am happy to join you for this first technical session for the celebration of the National Breastfeeding Awareness Month. The Calabarzon region, the breastfeeding advocates, and our proactive mother support groups are joining the rest of the country for this event. And as part of the mandate of DOH to promote, protect, and support breastfeeding, we, the Calabarzon region, are continuously monitoring and assessing our hospitals to be mother-baby friendly hospitals, and as well as the companies and workplaces to be certified as mother-baby friendly workplace. So our goal in the region is to be mother-baby friendly Calabarzon, Aya.
Yeah, and we're so grateful for the hard work that Calabarzon is doing, and at the same time for our other Centers for Health Development who are also with us today. And Jelly, I am really glad that you accepted our invitation for today. By the way, this is the first of two technical sessions for this month. And next week's Thursday on August 19, we will be having the second technical session focusing on the unified COVID-19 algorithms for the care of mothers and children. Of course, local government units, health facilities, and health workers, and anyone interested are invited. These technical sessions, by the way, were developed for health workers, health facilities, and local government units in mind to raise major issues that affect the care of mothers and children during the pandemic, especially when it affects infant and young child feeding. So, for everyone who are with us today, and please do tell your networks, do not forget to join us in our next technical session on August 19, where we shall be discussing the unified COVID-19 algorithms for maternal and child care during the pandemic.
Thank you so much, Aya.
Yeah.
Yes. So thank you. So this morning, we are glad to host this webinar on human milk banking in the Philippines. The goal is to provide information on the who human milk banks are for and who will benefit from this, and the how do we build milk banks, and most importantly, why do we need human milk banks. So Aya, just a short sharing before we introduce our speakers.
Sure.
Last June, our region just conducted an orientation on human milk bank with Dr. Auli Badia of PGH Human Milk Bank, and we had a great discussion about it, and it really stimulates the idea of our participants to push for the creation and establishment of milk banks. So today I am excited to learn more and be updated with our great speakers. So this is truly an interesting topic and a hot issue now in our country.
Yes,
So
it
Aya.
is. Oh, okay. So since you sound so excited, Jelly, and I'm sure our participants are also excited. Um, we are going to have two speakers, and the first one I am proud to introduce. She will be providing us on the discussion with a discussion on what human milk banking is, with some ethical background on handling breast milk. We have with us Dr. Esperia Olonan Husi, who we fondly call Doc Star. Not only is she the president of the Human Milk Bank Association of the Philippines, but she actually has a lot of heavy and important roles. She is the chair of the pediatrics department of Dr. Jose Fabella Memorial Hospital, and she is also chair of the adolescent and reproductive health committee of the same hospital. She is also part of the lecturing team of the Department of Health for essential maternal newborn care and lactation management training. And this is something you're very familiar with, Jelly. Okay, so back to Doc Star. She is a graduate of Bicol Christian College of Medicine. She took her internship at the Jose Reyes Memorial Medical Center, residency at the Dr. Jose Fabella Memorial Hospital, which eventually became her home base. Her fellowship was with the Philippine General Hospital on Adolescent Medicine, and she has a master's degree on public management, specializing in health governance from the Ateneo de Manila University. We are fortunate that Doc Star is with us today.
Yes, but before we go with Dr. Star's topic, we will introduce the Human Milk Bank situation in our very own neighborhood here in the Southeast Asia. With us is Dr. Paul Andrew Zambrano, Regional Technical Advisor for Alive and Thrive Southeast Asia. Doc Paul is a medical doctor and public health nutrition specialist with a decade of experience in maternal and child nutrition, humanitarian coordination, and management of acute malnutrition. At Alive and Thrive, Doc Paul provides a technical support to strengthen the policy environment and breastfeeding health systems and social change strategies in the ASEAN, as well as manages the global e-learning project. Before going to Alive and Thrive, Doc Paul worked with UNICEF Philippines and Myanmar, Save the Children, and the World Health Organization. He obtained his medical degree from the University of the Philippines, Manila, and earns a master's degree in nutrition for global health from the London School of Hygiene and Tropical Medicine. So to begin, may I call on the virtual floor, Dr. Paul Zambrano. Good morning, Doc Paul.
Hi everyone, good morning. Kamusta
morning,
yung, kamusta yung audio ko? Okay naman?
Yes, Doc. Loud and clear.
Okay, so start na ako mag-share this. Okay, naka-load na ba?
Yes, Doc Paul.
Okay, okay, sige. So good morning po sa lahat. Salamat po dun sa magandang introduction. Ako po si Paul Zambrano, Regional Technical Advisor ng Alive and Thrive. So i-introhan ko po yung presentation ni Doc Star, but also describe the work around human milk banking globally, but more focused in Southeast Asia and what role the Philippines is playing in that work. So I think before the most important thing to emphasize early on is that the role of human milk banking is based on the recommendation of WHO. So in the 2011 guidelines of WHO, they are saying that in the hierarchy of feeding options for vulnerable infants with a focus on low birth weight, that the primary recommendation or feeding option that should be in place is of course breastfeeding and the mother's own milk. If it's not possible, then it should be feeding should be done through donor human milk from a human milk bank. But as we know many times, step 1 and 2, madalas na si skip yan, dumidiretso kagad sa artificial feeding. And we know that there is a risk to doing this. And we also know that use of donor human milk is very beneficial. So this is a long list of the impact of having donor human milk available in a setting where vulnerable infants are being treated. So I won't go through all of this one by one, but just to highlight a few. So yung necrotizing enterocolitis, which is very deadly for vulnerable infants, so the risk is dramatically reduced. Same with other illnesses that contribute to neonatal mortality. But it's not only in that regard that access to donor human milk has an impact. We also know that in the short term and longer term, the breastfeeding outcomes can be improved if there is access to not just donor human milk, but appropriate breastfeeding support in this setting. So another key message is that, and I think Dr. Star will also emphasize this, is that human milk banks, as mentioned by our introduction also this morning, they are there to help protect, promote, and support breastfeeding. They are not a replacement for breastfeeding, and they should not be a reason why breastfeeding is stopped or not actively supported. So in that context, a human milk bank should exist in a setting where you have all the other ingredients of a good enabling environment. So yung milk code or whatever code the country has, dapat in place yan. So there's no promotion of BMS. No, there should be an overall friendly policy environment pagdating sa breastfeeding support in the health system. The hospital should ideally be a mother-baby friendly health facility. And then the role then of human milk banks, when all of these elements are in place, is to help improve optimal breastfeeding practices in addition to preventing the risk of illness and death. So Alive and Thrive came into the human milk banking work through because we helped Vietnam establish their first 3 human milk banks. And this is just a way of illustrating ano ba yung proseso ng human milk banking. It's not just as mentioned by our introduction this morning, it's not just about a repository for breast milk to be used for whatever purpose. No? Meron talagang proseso yan, and it can be divided into 3 broad categories: the collection ng raw milk from which includes recruiting a mother, and then the processing of the milk, and then its use. So in each of these steps, quality and safety should be assured. And we learned from the experience in Vietnam and other countries. So we have these 4 key learnings. So the first is that human milk bank establishment is an investment. It's an investment not just on the human milk bank itself, but on the surrounding policies that make sure that the human milk banks function the way they should. So important dito yung EINC, no? Yung pagiging breastfeeding friendly ng health facility natin, and yung availability of breastfeeding support within in and around the NICU setting. So like for example, if Avail is a good example, no? Katabi ng human milk bank yung KMC ward. So it's not something, because it's an investment, kailangan ng resources. Second lesson is we know that human milk banks are exciting. We know that many LGUs and hospitals would like to establish it, but there are cases where you have to do some thinking around kailangan ba ng napakaraming human milk bank? Or kailangan ba na mayroong network wherein ang mga hospital nakakaroon ng access to human milk, even if they don't have a milk bank? So for example, in Ho Chi Minh City sa Vietnam, yung milk bank nila dahil napakalaki, sila yung nagsusupply ng donor human milk sa ibang hospital na walang human milk bank. Third key lesson is about standardization. It's important for national guidelines to be present. So there are norms and standards on what human milk bank or how human milk banks operate in a country. Hindi pwedeng iba-iba yung operation ng human milk bank between one and the other. Kasi na important yung quality and safety, and we have global standards for this. And then last is, it's important for human milk banks to also be learning and research and learning centers. And it's also important for human milk banks within the same country or within the same region to have some kind of network. So this is a map of human milk banks around the world. Actually, tingin ko marami pang kulang dito. So we can see, there's a lot in North America, there's a lot in South America, in UK, hindi mo na makita yung isla ng UK sa dami ng dot. But there's also quite a number in Southeast Asia, but we don't have. And before 2019, we didn't have our own association or our own network. So Alive and Thrive reached out to the Human Milk Bank Association of the Philippines. I think at the time they were the only formally convened Human Milk Bank Association to initially be the first convener of the regional Human Milk Bank network for Southeast Asia and beyond. And currently we have membership from the following countries: of course, Philippines, both member and lead, but we also have membership from Myanmar, Thailand, Vietnam, Singapore, China. They were very active when we first formed the network. But we also have members from Malaysia and Indonesia, and kaya may asterisk yung pangalan nila is because they don't have a human milk bank yet, no? But they are engaging with the network because they are trying to establish both the technical standards, but also the trying to navigate yung religious concerns nila, which are related to yung concept of human milk kinship, sa Islamic settings. So the vision for the network was to be not just a social network, hindi lang to chikahan at chismisan, but it's primarily a knowledge exchange platform. So for countries without guidelines, the countries with guidelines can help support them. For countries with guidelines but would like to improve them or maybe establish more milk banks and scale up, this could be the network where more similar settings, kumbaga mas magkakapareho ang nagtutulungan kaysa we always rely on input and guidance from high income settings. So 2019 was a busy year for the network. So we had several learning exchange visits. The first one of the main ones being a learning exchange visit to the Philippines. So in this photo, you see the members from the different countries visiting the Human Milk Bank in PCMC, and of course in the Human Milk Bank in Fadel Hospital. So you can see the participants actively taking notes, looking at looking at the operations. And then we also had a learning exchange visit between Indonesia and Vietnam. So yung the visit had two purposes. Yung una, dahil wala pang ang human milk bank in Indonesia, they want to see what it looks like. Ano ba itsura ng human milk bank? Kasi nababasa lang nila sa mga global documents but haven't seen it right in front of them. So they want to get a sense of the different types of human milk banks. So yung sa kaliwang picture was in Da Nang, which was a smaller human milk bank, but the first in Vietnam. And the right side is in Ho Chi Minh City, which is a bigger, newer human milk bank. And the second purpose of the Indonesians visiting Vietnam was to also dispel some misconceptions they may have about human milk banking, particularly among the religious sector. So yung participants sa visit na to also included representatives from the Islamic Religious Council, and it was very helpful for them because ang dami palang misconception na na-dispel just by visiting human milk banks and seeing them at work. We were working to, I'll show you later a document that the regional network has been working on, but we all know, alam naman natin lahat kung ano nangyari nung simula ng 2020, karoon ng pandemic, so tigil muna yung mga learning visit, but the network's work did not stop. So we identified a lot of issues around the country guidelines and how they are not aligned with the WHO recommendations, but also we saw that human milk bank and access to pasteurized donor human milk was not mentioned too much in the country guidelines for COVID-19. So we developed this joint statement, which we published in the International Breastfeeding Journal. So you'll find the link here, but also later I'll put the link in the chat window. So the authors of the statement are the members of the network from the different countries. So we had to go virtual to complete the biggest project of the network, which is to develop the regional standards for human milk banking in Southeast Asia. So we know that there aren't currently any WHO guidelines, but given the similar challenges in the region, we thought it would be a great document to have a regional standards developed that other countries can use to improve their guidelines, but also to develop new guidelines kung wala pa sila. So for this, we asked for help from a global pioneer and expert in human milk banking, Ms. Gillian Weaver, and we are aiming to launch these standards by the end of this month. So we hope, I think some of you might be invited there, so we hope to see you for the launching of this important document. So I think I'll end there, but just to say that Alive and Thrive, we are managed by FHI 360 and currently funded by the Bill and Melinda Gates Foundation, the Government of Ireland, and UNICEF. And we declare that we do not and will not receive any kind of funding from infant formula companies and baby food companies. Thank you, everyone. Back to you, Aya.
Thank you so much, Dr. Zambrano, Doc Paul, as we all know him. Okay, so with that introduction about the situation, the general situation of human milk banking in Southeast Asia, we now go to the Philippines. Doc Star, hi ma'am. So we earlier on introduced Doc Star, and she will be doing the discussion on human milk banking here in the Philippines. Hi ma'am.
Morning.
Good morning po.
Okay, so I may share my screen. Sorry. Bakit may napindot? Hello, good morning. Is my sound and slides okay?
You look great, ma'am, and you sound great.
Okay. Thank you, Aya. Okay, so once again, good morning, everyone, and thank you, Aya, for that kind introduction. On behalf of the Human Milk Bank Association of the Philippines, I would like to thank the Department of Health for this opportunity to participate in this activity in celebration of the National Breastfeeding Awareness Month. For my disclosure, I have nothing to disclose. Today, I am tasked to give a presentation that will basically answer the who's, why's, and how's of establishing human milk banks. But before I discuss further on that, let me refresh you with the history of human milk banking and about our organization. Human milk banking started in, sorry. So human milk banking started in 1909 in Vienna, Austria, with the first human milk bank that was established and was followed in a year in Boston, USA, and then more followed all over the world. To date, around 750 human milk banks were established in 66 countries globally, including the Philippines. So where it has started in 1996 until in 2009, we have 3 operational human milk banks. Human milk banking is one of the ways to achieve the Millennium Development Goals, as well as it is the path where the infant and young child feeding strategic plan was anchored. The IYCF Global Strategy was adopted by the Department of Health, believing on the evidence that it can contribute to the nutrition, health, and development of infants and young children even during emergency. So in 2011, the Department of Health gathered the local experts with experience in human milk banking in the country and formed the Philippine National Committee on Human Milk Banking that harmonized the guidelines of the 3 human milk banks, producing the National Manual of Operations, and also to provide technical assistance to the Department of Health. With the Manual of Operations, trainings on human milk banks with funding from the Department of Health were conducted. So since then, human milk banks in the country is growing in number. Thus, an organization was formed, the Human Milk Bank Association of the Philippines, which is a formally convened organization in 2018, with a vision as the leading organization in ensuring excellence for human milk banking in the Philippines, Southeast Asia, and beyond, guided by its mission, objectives, and core values. The Human Milk Bank Association of the Philippines, or HMBAP, welcomes membership from human milk banks and individuals who support the goals of the association, like doctors, nurses, midwives, medical technologists, and advocates. At present, there are 102 individual members and 15 member human milk banks. Being a newly established organization, it already had a major engagement in convening the regional network of human milk banks in Southeast Asia with support from Alive and Thrive in 2019, as mentioned by Dr. Paul. So that same year, it also held its first scientific conference and then became a member of the virtual network of the Global Alliance of Milk Banks and Associations, called the GAMBA, and had several activities in 2020. So now, What is a human milk bank? A human milk bank is a non-profit service with system of processes for the recruitment and selection of donors, collecting, processing, screening, storing, and distributing donated human milk to individuals for whom it is prescribed. However, there are some misconceptions in establishing human milk banks, and the most common of which is that it is for profit and it may undermine breastfeeding. That is why we have to understand why human milk banks are being established. So as Dr. Paul mentioned already, maybe some of the reasons, it is a known fact that mother's breast milk provides the optimum nutrition for growth and development of infants due to the essential nutrients and protective components. But for some infants who do not have access to their mother's own milk, the World Health Organization recommends donor human milk as the next best infant feeding option. The approval of the implementing rules and regulations of the Republic Act number 10028, encouraging health institutions to put up human milk banks, where human milk banks ensure that every infant has access to safe donor human milk and its superiority in the nourishment and treatment of conditions associated with prematurity and other neonatal illnesses has been proven. It is the ideal nutrition for the critically ill and premature infants, lowers the rate of infection, and prevents necrotizing enterocolitis. In the commentary of the Committee on Nutrition of the European Society for Pediatric Gastroenterology, Hepatology, and Nutrition, the protection against necrotizing enterocolitis is the major clinical benefit deriving from the use of donor human milk. They also stated that the presence of human milk banks does not decrease the breastfeeding rate at discharge, but decrease the use of formula during the first weeks of life. Likewise, in the study by Arslanoglu et al., shows that the presence of human milk bank and the use of donor human milk is associated with elevated rate of exclusive breastfeeding and very low birth weight infants. Milk banks also provide donor human milk during emergencies, may it be natural, man-made, disaster, or pandemic. But let us remember that the use of donor human milk is only temporary while mothers are being supported to establish their own breast milk supply. Therefore, now you see that human milk banks do not undermine breastfeeding because they were seen as part of the strategy to protect, promote, and support breastfeeding. Currently, there are 27 operational human milk banks in our country. Majority of them, or 17 of them, are located at the National Capital Region. There are only 1 human milk banks in the different regions except for the following regions who do not have yet. So as you all know, there is also an increase of interest in milk banking all over the world as well as in our country, particularly in those areas where human milk banks must be strategically established. So for those who wanted to put up a human milk bank, it is imperative to have some basic information about what it takes to develop a human milk bank. In establishing or setting up a human milk bank, there are 3 recommended steps from the resource toolkit that was established by the PATH of the Program for Appropriate Technology in Health, or it is a global health organization, and this toolkit will help us. So this is an assessment tool for determining facility readiness for the integration of a human milk bank into a breastfeeding friendly health system. So the first step is to identify a multidisciplinary team. This is the leadership team, which includes experts from the following expertise. You have to identify a representative from the facility and also from the local authority. So this leadership team will convene to assess readiness and identify optimal integration to ensure all infants receive human milk. And the second step is to gather data necessary for informed decision making. So you have here the list of the data that you have to get, because you need to know this statistical data, because this will help you accurately assess the current neonatal and maternal lactation environment in your hospital. The third is to assess readiness by answering the key questions in the 9 sections as follows. And this is to prevent future overuse of donor human milk, ensure support structure for sustainability, and align with the goal to improve rather than undermine breastfeeding. Now, your first question would be, are there specific reasons
Hello, Doc Star. Okay, we'll just give Doc Star a few seconds just to recover. Maybe she's having troubles with her internet connection.
Okay, so while waiting for Dr. Star, we have 452 participants now in our Zoom webinar. So we would like to say hello to our participants
Yeah.
who are posting their messages in our chat box.
Yes, and Angeli, just to add,
sorry,
there are also.
I got lost.
Okay,
Ayan,
ma'am.
yes,
So,
Doc Star.
before we go back, while Docstar is preparing, we already have inquiries about the manual of operations for the human milk banking. We have the 2013 manual of operations. We are we are glad to provide you with a copy. Just email us at familyhealthoffice@doh.gov.ph. Docstar, hi, ma'am.
Hi. Oh, sorry, I got lost.
Okay, it
I was
happens.
connected. Yeah. From what part?
You are already at the DHM portion.
Okay.
And later on, by the way, for our participants, we will also be posting the evaluation form. And once you answer the evaluation form, you will be able to get the certificate of participation for this event. So, okay, there you go. That's the last slide you had, Dr.
So
Thank you for
I
coming
was
back to
here.
us.
Sorry. Okay, so as I was saying that identifying the need for donor human milk will help the planning of the proposed human milk bank. So the next question is, have you identified potential future human milk donors that can provide sufficient volumes of donor human milk to meet the needs? So we have here the following as the type of donors that you may consider, because it is important in assessing the feasibility of establishing a milk bank to which donor populations are most suitable to meet the need for donating milk, including its future sustainability. And the third is, have national infant feeding policies that impact the establishment and the use of donor human milk been identified? So I know we have a lot of policies, and it is also good to be familiar with the recommendations of international, national, and local policies that supports the safety, sustainability, and accessibility of donor human milk. Now, the next are questions about identifying local leadership and support. Is there an identified champion dedicated and committed to the promotion and establishment of a milk bank? The champion is one who has appropriate authority with clinical and operational expertise, ensures the quality assurance methods are in place, and provides clinical guidance for the use of donor human milk. Has the facility leadership provided approval for the establishment of a human milk bank? Because the facility leadership approval is important in terms of the financial and logistic support, as well as the provision of the staff. Another equally important question is, did the leaders at the regional and national level provide approval for the human milk bank? Their approval too will also be helpful, for their support is essential to ensure sustainability of the project. Then, we identify the essential infrastructure, space, and equipment. Has the location of the space for the establishment of the human milk bank been determined? The location and provision of adequate space are important to optimize the location of the equipment, as well as to provide optimal facilities for the counseling of mothers, hygienic breast milk expression, and storage area. Are the required equipment were identified for procurement? Here is a list of the equipment that you can consider, because this will also influence the design of the internal space of the human milk bank. Now, after identifying the infrastructure and equipment, staffing requirements is also crucial in establishing the human milk bank. Have you identified the staff of your human milk bank? Let us keep in mind that human milk bank requires trained staff to ensure safety and
Okay. While we're waiting again for Doc Star, let me just repeat that for the requests for the human milk banking manual of operations, you can request it through Family Health Office at toh.gov.ph. Sorry, Doc Star, are you there?
hello again.
Yes, ma'am. Okay, it's okay, ma'am.
Sorry for this. Maybe, okay, is it in this slide?
Yes, that is your last slide, ma'am.
Yes, okay. So, as I was saying, that like any other food operations, standard operating procedures need to be followed. Hence, a major aspect would be on the quality control systems. And the questions are, does the facility have access to a certified laboratory that is able to perform microbial testing with human milk? Human milk banks need a quality control check of the microbial contamination of the human milk by doing pre- and post-pasteurization culture. And also, given the risk of contamination in handling the human milk, does the facility have appropriate hospital cleaning, disinfection, and equipment maintenance services? So to ensure the safety and quality of donor human milk, all equipment should be maintained according to the manufacturer's instructions or recommendations. Also, under the quality control systems, it is important to know if there is a local or any relevant compliance regulations, accreditations, or certifications to be acquired, which is not yet in place in our country, but is already underway. Moving on, very relevant questions are also about the financial considerations. Has an initial budget been prepared for the startup and ongoing costs? Have appropriate funding sources been identified? First is to determine if the facility is able to provide funding for all of the startup and ongoing costs. As you can see in the slide, here are the list of the startup and ongoing costs. So if not, an alternative funding sources may need to be identified, like grants, sponsorships that will be able to support the costs incurred by the planned human milk bank. That's why budgeting should be both for the startup and ongoing costs, and identifying sustainable funding sources will be essential, not only for the facility changes, but the training of the staff. That is why building a network with other milk banks would be helpful, as they can offer valuable support and serve as learning sites for building the initial knowledge base through site visits and knowledge sharing. So it is important to recognize also the additional needs beyond the facility, especially when donations are coming from outside the facility. Human milk bank networks can be formed to support the core package of healthcare services within the local service delivery network, as illustrated in this figure or model, which is from the draft policy guidelines of the Department of Health that is coming soon. Donor human milk depot can be established in the community as a way of increasing human milk bank's operational capacity and donor human milk provision for all vulnerable infants. So with all of these key questions, you now know how to proceed with the establishment of a human milk bank. But a more detailed information are discussed in the training of human milk banking. As for the future plans on human milk banking, it would be directed to the following: a regulatory framework for accreditation or certification of existing human milk banks, and those to be established must be in place to promote the best practices in human milk banking and avoid misuse of donor human milk. Implementation of the hazard analysis and critical control point is also one to achieve the highest quality of donor human milk. We also have to settle ethical issues related to human milk banking. Example of key ethical considerations can be the informed consent, how to increase the limited supply, allocation of scarce resource, also concerns linked to marketing of pasteurized donor human milk, conflict of interests, and informal milk sharing or selling of raw milk. The Human Milk Bank Association of the Philippines has prepared and will issue a position statement on informal milk sharing and does not recommend this practice. So lastly, let us also wait for the issuance of the national guidelines on the establishment of and operations of human milk banks by the Department of Health. So in summary, I have presented why human milk banks are established, who are the persons to be involved, and how to go about its establishment. So thank you very much.
Thank you so much for your presentation, Doc Star. So, ngayon pa lang marami na tayong nakikitang mga katanungan sa ating Q&A panel. So, maybe invite Doc Paul to also join us for our panel. I actually have, if you allow me, Jelly,
Yes, Aya, go
I
ahead.
have the first question in here. Actually, ito yung pinakaunang tanong na pumasok habang nagre-present pa lang si Doc Paul. And isa ito rin sa mga magagandang questions that we can also discuss this morning to also give our participants some guidance from the actual experts. We have here again Dr. Paul Zambrano of Alive and Thrive and Dr. Star Husi from the Human Milk Bank Association of the Philippines. And we are now opening the floor for questions from our participants. So first, ang first question natin is, nasaan sa hierarchy ng donor human milk beneficiaries ang healthy newborns whose mothers are HIV positive and are not in ARV, yung antiretroviral therapy natin? Maybe this question could be answered by Doc Star.
Sorry, Aya, I
Yeah.
did not get it well.
Okay. So, again, yung question po is, doon po sa hierarchy ng donor human milk beneficiaries, nasaan po doon ang healthy newborns na ang kanilang na ipinanganak sa mga nanay na HIV positive and hindi pa po nakakapag-umpisa sa kanilang ARV therapy, sa kanilang antiretroviral therapy?
Okay. So, isa din yun sa mga indications for giving a donor human milk, but di ba sabi natin na kung ano naman pwede nga mag-breastfeed ang mother, pero yung kung gagamit at ang option ng mother is not to breastfeed, donor human milk can also be given. Kasama din sila sa prioritization. Meron kasi tayong prioritization criteria for the use of donor human milk.
All right. Thank you so much. Ito pong question na to ay nanggagaling po sa isang participant na ayaw magpa-identify. Ito po ay isang anonymous na participant. But it's good to know po that kasama pa rin sila doon sa hierarchy and they have a place in the hierarchy for donor human milk. Jelly, maybe you have another question for
Yes,
the
actually we have
panelists.
so many questions sa ating Q&A box. So, first question from Grace Elsa Albano from DOH CHD Region 11. So, can the milk of a COVID-19 positive lactating mother be donated in a human milk bank? So, I guess Doc Star can answer this.
Yes, maari pong i-donate ang kanyang breast milk because sa base sa pag-aaral, wala namang nakita na ang COVID-19 virus can be transmitted through the breast milk.
Okay, so thank you po, Doc Star. So, pwede po, no? Pwedeng i-donate. And another question from Ma'am Joyceline Dote. Madedetect po ba sa breast milk na dinonate kung may COVID ang mother na nagbigay? May way po ba tayo to detect?
Sa ngayon sa atin dito, wala tayong masyadong capability to detect the virus. Pero siyempre kung i-detect kasi natin, that's a viral culture ang dapat nating gawin para makita natin kung nandoon. Pero kung makikita natin sa mga studies, wala namang nakitang virus talaga. Tama ba, Dr. Paul? Based on the studies that has been released?
So far parang wala naman. And even if may virus, I think some studies show na yung pasteurization is able to get rid of the SARS-CoV-2 virus. But partly to answer yung question if it can be detected sa breast milk, hindi ko alam kung yung question yun is related to yung pag-screen ng milk or pre-pasteurization assessment. So siguro emphasis lang din kasi di lang naman nagko-collect ng breast milk, diba? So kasama dun sa proseso yung pag-screen ng donor. So part nung statement ng regional network for COVID-19 was to make sure na yung screening ng donor mothers, merong questions doon to elicit potential exposure to COVID-19.
Yes, kasama na rin yun dun sa screening pa lang para kung pwedeng ma-qualify ang isang mother breastfeeding mothers who are willing to donate. So nandoon na po yun. Idinagdag po namin yan with the COVID-19 pandemic. Kaya nga po talaga, sabi ko dun sa una din na is yung COVID kasi is virus. So with the laboratory test that we are doing, it's the culture. So hindi yun makukuha ng pre and post pasteurization culture kasi virus siya. Bacteria po yung nakikita natin doon.
All right. Thank you, Doc Star and Doc Paul. Again, a gentle reminder para sa ating mga participants, kung kayo ay may katanungan, pakilagay po ito sa Q&A panel natin. Dahil ang chat box po natin ay medyo nagiging palengke na po. Kailangan na po natin i-regulate yung ating mga inputs doon sa chat box. But definitely, kapag napunta po sa ating Q&A panel ng yung mga katanungan, we will try to entertain them as much as possible. Okay, para sa ating next question, I think mas maganda kung mauumpisan po ang pagsagot nito ni Dr. Paul Zambrano ng Alive and Thrive. So meron tayong katanungan dito mula kay Care Mogol. How can organizations balance between providing donated breast milk and empowering mothers to be self-sufficient? Coming from a mother support group standpoint, many healthcare providers direct mothers to mother support groups without healthcare providing proper guidance on how to express mother's own milk. So I think she's trying to say na we have healthcare providers who refer mothers who cannot breastfeed or who are in search of breast milk sa mga mother support groups, but that's where it ends, just referrals and wala siyang guidance. So Dr. Zambrano, what can you say about this? Yung hinahanap yung balance between providing donated breast milk and empowering mothers to be self-sufficient.
I think I'll go back to one of the isa sa mga fundamental key message ng presentation namin ni Doc Star is para sa kanino at para saan ba ang donor human milk. So it is not for mothers who have breastfeeding problems and therefore feel that they need milk from elsewhere. Meron talagang specific target group ito, which are vulnerable infants at the top of the hierarchy. So yung mga preterm and low birth weight, yung mga tinatawag natin small and sick newborns. No? So yun yung priority nun. But also, yung point ni Doc Star kanina, that is a temporary measure. Kaya dapat yung pag-implement ng Human Milk Bank, very clear on hanggang saan lang yung donor human milk, and dapat may breastfeeding support within that hospital para pagtapos na yung provision ng donor human milk, pag-kick in na doon yung support for the mother to be able to continue breastfeeding. So I guess it's a message to all the health workers na dapat aligned. Kaya important yung Philippine guidelines na para malinaw kung para saan ba yung gatas na nasa Human Milk Bank. I think no health worker should, kapag may naharap na nanay na nagkakaroon ng problema sa breastfeeding, dapat hindi ang unang iisipin, ipadala yan sa Human Milk Bank. Dapat hindi ganun yung thinking natin. Kasi yung importance of the breastfeeding support group, I would say siguro 98, 99% of the problems doon pwedeng ma-address doon. But for small and sick newborns na walang access to other mother's own milk or breastfeeding, yung unang dalawa sa hierarchy ng WHO, doon lang papasok yung pasteurized donor human milk. And with the conditions nga na the aim is to temporarily provide it but go to breastfeeding as soon as possible later on. So I hope that it answers the question.
Yes, thank you, Doc Paul. So anything to add po, Doc Star, to what Doc Paul just said?
Yes, okay. So unang-una siguro talaga dapat bumalik po tayo doon sa kasi ang tanong is how to balance. Unang-una tatandaan natin na ang pinaka-the best is mother's own milk. So every healthcare providers, unang-una sana maging baby-friendly. Mother-baby friendly healthcare providers. So ang nakikita kasi natin dito, nagkukulang or hindi binibigyan ng oras ng isang healthcare provider ang isang ina na mabigyan ng suporta sa pagpapasuso. Kasi ito muna kasi yung una nating titingnan, that own mothers breast milk muna ang gagamitin. Kaya sabi natin doon, for those babies who do not have access to mother's own milk, and that's the time that they can use donor human milk. Tama po, di ba? Yun yung ating message dito. Kaya napaka-importante na ang isang healthcare provider ay marunong mag-counsel, mag-encourage, mag-support sa isang nanay bago magpunta o bago i-refer. Although pwede naman pong i-refer, pero primarily you should also do your part. Kasi tama naman, maganda at marami tayong mga mother support groups who can also help us. But as a healthcare provider taking care of these babies, dapat manggaling po yun sa atin. Malaking bagay din yun na tulong na maibibigay natin sa isang ina to help the mother and support the mother to produce her breast milk. So ang nangyayari kasi, hindi yun binibigyan ng pansin, hindi binibigyan ng panahon. Yun ang nakikita ko. That is my observation. But I think it's true and you would also agree with me. So ang donor human milk, sabi nga natin, the same what Dr. Paul said, that it is temporary. Kaya nandoon in the event na talagang kulang or insufficient, then the human milk bank provides donor human milk na andyan para ma-bridge yung gap na si mommy ay matulungan natin until she can produce enough for her baby. So di ba yung pagtulong natin sa isang mother, hindi yun kung kailan, kung ilang buwan na o ilang araw, iba it starts upon birth, after birth, nagsisimula doon. So siguro yun lang yung gusto kong i-emphasize dito kasi mababalance naman yun if really the healthcare provider will do her part or his part, or us as a healthcare provider will do our part.
Yeah. And Doc Star, madagdag lang po, ang lagi rin nating ina-advocate pagdating sa ating lactation management trainings is that yung infant and young child feeding advice for breastfeeding and complementary feeding, nagsisimula na ito prenatal pa lang or kahit bago pa mabuntis yung nanay para nakakapagsimula na siya makapaghanda po para sa pagpapasuso, pati po doon sa pati po doon sa mga sitwasyon na ganito na kung hindi ako makapagpasuso agad, ano yung maaari pang gawin. So talagang ihahanda both ang health workers at ang nanay para makapagbigay ng appropriate support. Kaya nung sinabi rin kanina ni Doc Paul, kailangan masusundan din yung hierarchy of infant feeding natin. So magsisimula tayo sa direct latching and later on na yung paggamit ng donor human milk. And kapag hindi na ito na-resolve, then we go through the rest of the hierarchy para dito. Okay, so Jelly, maybe marami tayong mga katanungan.
Yes, we have 16 questions waiting. So allow me to read the next question from Louis Ann Fernandez. Are there trainings available for the staffs? If so, where are these available and who are qualified to train the staffs? So I guess interested sila, Doc, for to establish human milk bank. Doc Star.
Okay. So meron po tayong isinasagawang human milk bank training. You can just coordinate with the Human Milk Bank Association of the Philippines or here at Dr. Josefa Belia Memorial Hospital Human Milk Bank, where also the office of the association is located. So this year, since nga nag-pandemic, we are preparing for a virtual training which will be held this September. So ito yung una. Then kung talagang hindi po ma-accommodate ang lahat na participants for the first batch, we can conduct another batch para mabigyan namin kayo ng nararapat na training about human milk banking, and para kung doon sa mga gustong tayo na hospitals ng human milk bank, they can be guided, they will have the appropriate knowledge about human milk banking, because in this webinar, it's only an parang background, mahaba pa yung ating pag-uusapan about the establishment of human milk banking. So yun lang yun, at least nagkaroon ng idea on how to go about it, anong gagawin para kung ito ay if human milk banking is being contemplated by an institution. So nandun po, napakita rin natin doon kanina na ano yung mga kailangan, what they are going to consider in the planning of a human milk bank. Kasi kung wala po yung iba doon, mukhang hindi din posible or mahirap din magtayo ng human milk bank kung it's just for dahil sa ganito or pero since andun kasi ano yung purpose natin of establishing a human milk bank.
Okay, thank you po, Doc. So, follow up din, what are the requirements naman po for individual membership to Human Milk Bank Association of the Philippines from Ma'am Myla Beatriz Gregorio? Paano daw po maging member?
Okay, so I have shown also in the presentation, individuals can also be a member, especially those doctors, nurses, midwives, or even the medtechs and advocates na nagsusupport ng goal ng association. Primarily, I would like to emphasize also, if you are wanted to be involved in human milk banking, tandaan natin, there should be no conflict of interest. Yun yung lagi nating iisipin kasi ang ating goal is of course for our infants, yung survival and health of these infants. Sorry.
Okay, thank you po, Doc. From Ma'am Claire Mogol, question, what can the government also do about mothers selling their own breast milk? So alam ko, madami po nito, very rampant ito sa Facebook. So do we have a law already regarding regulation of this breast milk selling? So yun po. Meron na po ba tayong law? Doc Paul, meron po ba kayong experience sa other countries nang nagsisell din ng breast milk?
Yung question on the law, I think ibabato ko yun kay Aya. Pero yung experience ng other countries on regulating the practice. So the answer is it depends. Kasi depende kung doon sa bansa, kung saan nila nilalagay or kinakategorize yung donor human milk. So yung ibang country kasi categorize siya as food. Sa ibang country, categorized siya as product or tissue of human origin, parang blood. So kapag nandun siya sa category na yon, hindi mo siya basta-basta i-donate. Kuwari, wala naman nagbebenta ng dugo sa Facebook, di ba? Unless meron pala. So parang so depende. No? So yung how the government defines the donor human milk, doon din ang gagan, doon yung regulatory framework, doon din umiikot. So sige, bato ko na kay Aya yung question on what regulations we currently have.
Yeah. Really, we don't have any regulations, but given that FDA has already flagged this issue because marami nang nagre-report sa kanila about doon sa mga nabili nilang breast milk, mga nanay ito na nakabili ng breast milk mula sa internet na biglang lasang condensed milk pala nung nakarating na sa kanila. Naging signal and matagal na rin ito nasa table sa pakikipag-usap natin with Alive and Thrive and DocStar. We will be coming up with yung regulatory framework on how do you manage yung products of human origin na kagaya nitong breast milk. Kasi sa ngayon, pagdating sa mga products of human origin, meron na tayong mga regulations para sa ating mga organs, yung para sa mga donation for transplant. But we also have regulations for blood, but breast milk is very unique because not only is this a product of human origin, this is also food. So this is something that we are going to work on with FDA and a lot more of our partners. And hopefully maybe by November 2021, we already have a policy regulating this, regulating the sharing, distribution, and selling of breast milk. Because definitely this is not something that can go on. Okay, hindi ako part ng panel, so I have to stop there. Jelly, baka meron ka pang questions? Or?
Yes, may 16 questions pa tayo dito sa ating Q&A. And a follow-up question for DocStar regarding po the schedule for technical training po for the human milk banks. May schedule na po ba, Doc?
Sa September, sorry, pang 5, 6, 7, basta first week of September.
So nakapost, ipapost naman natin yung Doc sa website ninyo. or Facebook?
Yes, ipopost na lang natin yung medyo, kasi una na-schedule namin last week this month, but medyo sabay-sabay yung activities, so we reschedule it the following month, September.
Okay, so abangan na lang po natin sa website ng Human Milk Bank Association of the Philippines regarding po dun sa schedule. And this is a comment from Sir Glenn Maticados. Hi everyone, the provincial government of Laguna has set a budget for the establishment of Human Milk Bank in the province in partnership with NGO and Latch. We have already requested to Human Milk Bank Association of the Philippines to be part of their next technical training. So please let us know what is the first step in the accreditation process with the DOH. Thank you so much. So next. So the first step, Aya, regarding the accreditation.
That question was for me. We are outlining the guidance for accreditation with the Department of Health. Please watch out for the guidelines that will be coming out before the end of the year. Also, this is a priority. This is a priority policy on our end. Because mataas na rin yung demand, and marami na rin nagtatanong kung paano pa dapat mag-establish ng human milk banks. Now, the establishment ng human milk banks, nandiyan ang Human Milk Bank Association of the Philippines to provide technical assistance for this. But the DOH will be working with them, with HMBAP and our partners, so that we can actually establish a process para madaling, not madali, pero para masusing ma-accredit or ma-certify ang ating mga human milk banks. Para up to standard naman din sila. Maybe ako naman ang pwede magtanong. Kasi
Okay, go. Bigla na punta sa'yo.
Huwag naman ako. Hindi ako, huwag ganun. Okay. So, this one. I think this is also a good question for Doc Star. Doc Star muna, and then I think the next question is better for Doc Paul. So, Doc Star, we have here a question. Our LG was planning to procure a breast milk pasteurizer. Where can we purchase this item following the purchasing procedure of the LGU, and what brand and specs? Doc Star, for this one, maybe we don't have to answer this now, but maybe you have an email address where people can send inquiries about specifications or how to go about training with HMBAC.
Okay.
Do you have the email address, ma'am? Sorry. I think it's I can type it in na lang later if you want. Okay, for this one, we will just provide for our participants, for those who have very specific questions like this, we will just provide the email address. If that's okay, Doc Star, we will just provide the email address of the association so that they can direct the questions to you, because you are the technical experts for this. Thank you.
Sure.
Okay, so this one is for Dr. Zambrano. So is it possible for human milk banks to tie up with NGOs for milk sharing or donation drives that would go through an app developed for this? There would be appropriate blockchain technology to ensure the privacy and processing of data. I'm directing this question to you, Dr. Paul, because Alive and Thrive has had experience in establishing human milk bank networks in other countries. This specific technology is still not in the Philippines. So what can you say about this?
I would say siguro yung app is just the tool for facilitating recruitment ng donors and but the next steps in screening, collection, etc. It will have to still follow yung country guidelines na dinevelop ng DOH. Tying up with NGOs for donation drives, I don't see a problem. Generally speaking, but we need to make sure now how do you conduct the donation drive, who is involved, and who is the NGO. If it's an NGO na walang conflict of interest, then fine. But if it's an NGO na meron palang ties or whoever with like formula milk companies, then of course we don't want that. But I guess yung app, in Vietnam, some areas use an app for recruitment, pero hindi siya super centralized. But pero more of community mobilization yung approach kasi sa Vietnam eh. Nagbago ng konti yung approach during the pandemic, but there's no like one unifying app-based solution. It's an option. Wala namang problema doon. But again, kung babalik tayo sa yung isang figure na finlash ko kanina and similar to yung pinakita ni Dr. Star, yung steps na from donor recruitment until use of milk, dapat lahat yon up to standard, and yung app will guide what happens a little bit before and after. Parang ganun.
All right. Thank you so much, Doc Paul. So again, the app itself, the technology is just a supportive measure so that we can establish yung ating human milk banking network. Okay. Jelly, maybe so that just a quick time check. It's already 11:22. We can entertain around 2 to 3 questions depending on the length. Depending on the question itself, and of course the length. Jelly, maybe you would like to ask the next question.
Yes, yung iba i-skip na natin, no, yung related na lang doon sa mga concerns talaga. Is there ito from Eza Canonigo, is there a possibility to establish human milk bank na hindi establish sa hospital? So outside the hospital po, Doc, ang magiging setting ng human milk bank. Is it possible po? From Miss Eza Canonigo.
Primarily, we want the human milk banks to be established within the hospital. Kasi kung titingnan nga natin ulit doon sa ating steps or in the questions, iba meron tayong tanong na sino yung sino yung mga recipients of the donor human milk. And then also syempre, the proximity of the donor human milk to the patients is also want to be considered. Kasi let us not be parang confused or magkaroon na ma-misled na anyone can just set up a human milk bank and anywhere it can be set up. So mas maganda po na ito ay nasa hospital setting.
Okay. So another question po, is there any prerequisites when someone wants to avail of breast milk from human milk bank?
Okay.
May requirements po ba?
So meron pong requirements kasi sabi nga natin donor human milk or pasteurized donor human milk is being provided to those infants for whom it is prescribed. So kailangan po natin ng prescription, a clinical abstract that comes from the doctor of the patient, of the baby, and of course they have to bring a cooler for the proper transportation of the milk kasi importante yun na ma-maintain natin yung temperature, yung parang cold chain, the same as with the vaccine kasi hindi pwedeng bit-bitin lang siya na para lang tayong bumili ng suka or toyo from the store. So kailangan po natin maintain yung temperature ng milk, otherwise masisira siya. So yun po yung mga requirements, and also human milk banks requires a processing fee. So yung processing fee, yun po yun yung payment for the cost of the yung sa mga tests, kung paano natin ginagawa yung para ma-pasteurize, but the donor milk itself is free. So yun yung para doon po, yun yung processing fee. It's not for the milk because the milk is also donated by the mothers, the generous mothers, for free. And syempre po, hindi naman po natin magagawa yung proseso ng pag-pasteurize ng donor milk kung wala tayong mga expenses na ginagamit. That's why very important yung doon sa kanina na binanggit ko na yung ongoing costs should be considered. Hindi lang tayo basta makapagtayo initially, andyan na yung yung iyong milk bank, but the sustainability of the operations is very important. Mas magastos actually kasi maraming kumbaga marami din yung dapat nating i-consider na these are expenses, and then sino yung mag-provide noon No, some human milk banks, alam natin, na itayo dahil with the help of the yung mga sponsors. Pero syempre, with the operation, yung human milk bank na ang dapat mag take care noon, tingnan nila kung paano yun aandar.
Thank you po, Dr. And last, I think we have to take our last question, if you'd allow me, Jelly. And this is a question for both Doc Paul and Doc Star. Okay, and I think this is yung pinaka-pressing na question ngayon given the lumalaking distribution network ng mga donated breast milk natin. So unang-una, safe po bang ibigay ang donated breast milk kahit hindi ito na-screen, yung pinanggalingan na mother at na-pasteurize? At ikalawa, kapag ikaw ba ay nagkaroon ng COVID, safe ba na mag-donate ng breast milk sa panahon ngayon? And not just COVID, but also kapag nakabakunahan ka na ba, safe ba na mag-donate ng gatas, ng breast milk mo, ng gatas ng ina ngayong mga panahon ng pandemya? Maybe Doc Paul and then Doc Star.
Okay, maraming layers yung tanong, no? So
Yeah.
I think I'll start with saying pwede pa restate yung first part ng question, Aya, para to make sure
Okay.
na tama yung bilin ko.
Ang unang question is, kapag ang donor ay hindi na-screen at ang gatas ay hindi na-pasteurize, safe po ba ito?
The answer is we don't know. Hindi natin alam. So remember na ang human milk bank, may principles yan eh. So the main one is the quality and safety of the milk. And then yung ensuring the safety and informed consent of the donor and ensuring the safe collection and storage. Lahat ng kaya importante yung standards, ang punot dulo niyan is maganda yung quality at safe yung produkto, which is the donor human milk. Kaya rin natin siya pinapasteurize, no? Kaya ka nagsiscreen. Pero so kung skip mo lahat ng step na yun, the bottom line is hindi mo alam kung safe. You don't know yung background ng mother, yung risk factors na meron siya. Wala kang guarantees. So that's the best answer. You don't know and it can't be assured.
All right. So for the next part ng question natin, maybe Doc Star can answer this. So kung ikaw ay may COVID, nagka-COVID o nagpabakuna laban sa COVID, safe rin ba na maging donor ka for human milk banks? Or safe ba ang iyong breast milk kung ito ay i-donate mo?
Nasabi natin na kanina na maaari namang mag-donate, pero siguro naman po, hindi naman natin siya pag-donatein while having the COVID. Pero after yun, pwede na naman po siyang makapag-donate ng kanyang gatas. And at the same time, syempre bago din siya makapag-donate ng kanyang milk, dadaan naman din po siya sa screening procedures. Diba, we have the screening, donor screening. Tinatanong po natin yung mga, may mga questions po tayong itinatanong sa kanya. And at the same time, after that, kung pwede po siya mag-donate, then that will anong susunod doon, yung serologic testing. So, dumadaan po. So, pwede po. Kahit mas maganda po, dumaan muna sa screening procedures ang isang donor. At doon din kasi natin masasabi kung talagang ay isang potential donor can be qualified to donate breast milk.
And Doc Star, yung last part is, what about vaccinated laban sa COVID ng mga nanay? Maari din ba sila mag-donate ng breast milk?
Maari silang mag-donate. Wala naman pa yata tayong naririnig na hindi sila pwedeng mag-donate or mag-breastfeed ng kanilang baby.
Okay. So, sa ngayon, isasara muna natin ang ating Q&A. Marami pa tayong mga katanungan na hindi nasagot. Jelly?
Yes, the questions na hindi po namin nasagot will be answered in our future webinars. Kaya standby lang po kayo sa mga susunod na technical sessions ng ating ni-ready po ng ating team. So, Aya?
Okay. So, mag-uumpisa na ako sa pinaka-summary natin. So, mula dun sa mga naging discussion natin, ang safety ay hindi mag-guarantee ng mga pinanggagalingan ng ating mga breast milk kung hindi sila dadaan sa screening. So ang pinakaunang hakbang talaga sa pagdodonate ng breast milk ay ang pag-screen. Kung hindi na-screen ang donor, hindi tayo sigurado sa safety ng ating breast milk. Kahit pa para ito sa mga human milk banks. Meron ding mga ethical considerations pagdating sa breast milk sharing. Pagdating sa breast milk sharing, hindi lang yung safety ang tinitingnan, kundi yung kapakanan ng nanay kung saan nanggagaling yung breast milk. Dahil maaring maging prone sila sa exploitation kung gagawin itong for trade, para kumita ang mga parties na interested na magbenta ng breast milk. So this is one thing na ay re-regulate by the end of the year ng Department of Health. Ikalawa, hindi recommended ang human milk sharing at meron din tayong guidance na hinihintay mula sa gobyerno, mula sa DOH at FDA tungkol dito. Pati na rin sa pag-i-establish ng ating Human Milk Banking ng ating Human Milk Bank. At nandito ang Human Milk Bank Association of the Philippines, pati ang Alive and Thrive bilang technical experts para tulungan tayo makapag-establish ng human milk banks sa Philippines. And again, paulit-ulit na sinabi dito sa session na ito at maging sa ating Q&A na hindi dapat agad maging solusyon ang human milk banks, ang pasteurized donor breast milk para sa mga sanggol na hindi agad nakakasuso at pangnanay na hindi agad nakakapagpasuso. Meron tayong tinatawag na hierarchy of infant feeding na mauuna po dapat muna na i-encourage na mag-latch at mag-breastfeed directly mula sa nanay at saka na i-consider yung ibang means of support doon sa pagpapakain sa bata kung ito ay hindi maiiwasan kung hindi maiiwasan na hindi makapagpasuso ang nanay. Okay, may dadagdag ka pa sa ating summary?
Yes, we must remember yung human milk bank do not undermine breastfeeding. It helps promote, protect, and support breastfeeding. And I like yung sinabi ni Doc Paul, yung sa investments in early essential newborn care and breastfeeding performance is a prerequisite before hospitals are expanding to specialized human milk bank services. So strengthen talaga natin yung ating counseling dun pa lang sa hospitals, yung maging mother-baby friendly hospital talaga, lahat ng hospitals po sa Pilipinas. And we also look forward to the final copy po ng ating mga manuals and yung ating minimum standards for the establishment of and operation of human milk banks. So with that, yun po ang ating takeaways for this webinar. Aya?
Yeah, maraming salamat, Jelly, at maraming salamat ulit kay Dr. Star, kay Dr. Estrella Olonan Husi, at kay Dr. Paul Andrew Zambrano. Doc Star is from the Human Milk Bank Association of the Philippines, and Dr. Zambrano is from Alive and Thrive Southeast Asia. Ito ay talagang napakailangan talaga ngayon sa ating sitwasyon kung saan biglang sumisikat na yung ating breast milk sharing, pati ang pag-i-establish ng Human Milk Bank. Kada linggo, meron na lang kaming nakukuhang inquiry sa Department of Health kung paano ba magtayo ng Human Milk Bank. At talagang tumataas na rin ang demand for breast milk sa ngayon. At para mag-close tayo sa session na ito, tatawagin po ang aming teammate na si Mr. Romeo Catbagan Jr. ng Department of Health, Disease Prevention and Control Bureau's Family Health Division, Technical Assistance and Resource Management Team para bigyan tayo ng mga huling paalala bago tayo magtapos sa session na ito. Sir June, good morning.
Good morning, Ma'am Aya. Naririnig po ba ako?
Opo, malinaw na malinaw.
Ayan. Unang-una po sa lahat, no, gusto ko pong magpasalamat sa ating mga knowledgeable and expert na ating resource person, si Dr. Star and Dr. Paul. And to you, Ma'am Aya and Ma'am Jelly Palencia, no? And to your team na nag-facilitate and nag-organize ng ating webinar. So, andyan din ang COICA, UNICEF, and Korean Embassy for supporting this activity. So maraming salamat. And of course, to the rest of our participants, viewers nationwide, CHDs, LGUs, and hospitals. Magandang umaga and salamat po sa pagdalo dito sa ating webinar. Nabanggit nga po, no, ng ating mga panelists and speakers that human milk bank is one of our core interventions in our system for managing small and low birth weight and very low birth weight babies or infants. So hindi talaga siya initially tinitignan para sa mga mothers na hindi nakakapagpasuso. So lagi po nating tatandaan yon na ito po ay para talaga intended for our low birth weight or sick children or babies. And currently, sabi nga po ni Dr. Vinluan na meron pa lang tayong 20 human milk banks. And we need really to establish a hospital network of human milk banks in strategic locations across the country. So I encourage po our LGUs, our health facilities, to assess or map na po yung ating jurisdictions wherein we can put in or establish human milk banks as a source of breast milk supply for the health and natural emergencies and disasters, no, for us para magkaroon ng supply of breast milk din for doon nga sa nabanggit nating mga low birth weight and very low birth weight infants or sick children. So alam naman po natin that breast milk has a complete immunologic and nourishing and psychosocial effects to our children, which is kailangan-kailangan ng ating mga babies. So with that po, no, I hope that this webinar has enlightened and encouraged our LGUs, kung meron pong mga local executives na nandito, health facilities, to establish human milk bank in our jurisdiction so that no small babies or low birth weight babies or motherless babies will be left behind. So yun lamang po. Thank you so much and magandang umaga.
Thank you so much, Sir June Katbagan. So we had a very interactive and informative webinar, and we thank again our Centers for Health Development, local government units, our mother support groups, health and nutrition workers, and health facilities, our hospitals who attended this webinar. And we would like to remind everyone about the registration for the next session.
All right, and thank you so much, Jelly, sa pagsali sa amin dito ngayon sa bilang napakagaling na moderator para sa session na ito, ang the who's, hows, and whys of establishing human milk banks dito sa Pilipinas. Again, maraming salamat po sa napaka-indulgent na ginawa, sa indulhensyang ginawa ng Human Milk Bank Association of the Philippines na pinangungunahan ni Dr. Star Husi. And maraming salamat din sa Alive and Thrive Southeast Asia na represented by Dr. Paul Zambrano. At maraming salamat din sa National Nutrition Council, sa National Nutrition Council Secretariat at sa mga regional offices ng National Nutrition Council. At definitely maraming salamat din sa ating mga Centers for Health Development who have also mobilized yun din yung ating mga LGU partners so that they can also get yung answers, direct answers para sa kanilang inquiries regarding human milk banking para sa kanilang mga localities. Maraming salamat din po sa mga mother support groups. Nakita po natin ng Latch Los Baños na actively na nagpa-participate ngayon sa ngayong umaga sa ating session, pati na ang mga kasamahan natin mula sa Advent Moms at Arugaan. Maraming salamat sa pagdalo ninyo dito at sana ay maging katulong pa rin namin kayo sa pag-spread, sa pagpapalat ng good word about breastfeeding. Again, reminder lang po sa ating mga participants na nasa ating mga chat box ang link sa ating evaluation form. Itong evaluation form na ito ay makakatulong sa amin na pagandahin pa ang ating mga webinars in the future. At bilang pag-recognize din sa inyong participation, kayo ay makakakuha ng certificate of participation. So Jelly, sa ating mga participants, sa ating speakers, at sa ating mga partners mula sa UNICEF, World Health Organization, sa Korean Embassy at sa POICA, and mula sa aming team, si Dr. Mimi Vinluan and si Dr. June Katbagan, maraming salamat po. Maraming salamat sa ating mga partners, and Jelly, super salamat talaga.
Thank you, Aya. Maraming salamat po sa lahat ng umattend. Bye.
Bye, everyone.
Thank you.
Let's go for healthy pregnancy. Tamang pagkain ng dapat para malusog kayo ni baby. Remember mga nanay, breastfeeding malaking bagay. Ito'y ipagpatuloy kahit na over 2 years old. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, Lacking 1, oh, 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 yan ang tamang paraan. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, Lacking 1, oh, 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 yan ang tamang paraan. Ang iyong little girl or boy, sustansya'y dapat puno. Susi sa tamang paglaki, go grow glow food na handa mo. First 1,000 days importante, healthy eating para kampante. Paghandaan nutrition ni baby, makinig sa sinasabi. Tamang nutrisyon, yan ang tamang solusyon. I like it, Lacking 1, oh, 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 yan ang tamang paraan. Tamang nutrisyon, yan ang tamang solusyon. I like it, Lacking 1, oh, 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 yan ang tamang paraan. Lacking 1, oh, 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 yan ang tamang paraan.
Nasa tiyan mo pa lang ako, alagang-alaga mo na ako.